Okay, this is a book review. The name of the book is Masters of Medicine by Andrew Lamb, MD. He's an ophthalmologist. He's the same guy who wrote this book, Saving Sight. I think Saving Sight was a better book. I gave it 7 out of 10 stars. This book, I give it 6 out of 10 stars. So, I'll tell you first of all, what do I think of Andrew Lamb? I think he's a good guy. I think his heart's in the right place. I think he wants to write a good book. I think he's just conventional and he's young. I'm going to guess his age. I don't know for sure. Probably about 42 years of age, early 40s. So he just doesn't know enough, okay? I mean, I've never in my life heard a doctor give a good lecture that was less than 40 years of age. You first of all have to learn all the conventional stuff. Then you have to learn that the conventional stuff is mostly a bunch of lies. Then you have to learn the truth, which you find from all over the place reading the medical literature. And then you have to dig around into other fields and make sense of it. Okay, and nobody's going to do that before they're 50, okay? Sometimes a guy will have had really unique experience in a narrow area and they can be great on that subject. His book on opto was actually really good was quite good because he knows opto. He's a fellowship trained like retinal surgeon. So all optos are pretty smart nowadays. They're all like the top 10% of their class. But just because somebody's, top 10% of their class in med school, even if they're first in their class, that doesn't mean they're a thinker. It just means they're good at memorization and they're a hard worker. Okay? So what's good about the book, Masters of Medicine? He writes clear. He's easy to understand. He tells the truth. He's trying to tell you what, he really learned from studying it. His just weaknesses, he doesn't know anything outside of conventional medicine. And there's a couple pitfalls related to that. He doesn't know anything about dental, about nutrition, about toxicology, about blood flow, about mitochondria, all these like really important subjects for putting stuff together. He doesn't know anything about, the gut, digestion, any of this stuff. What were the best parts of the book? I liked the chapters on infectious disease, the sort of the battles, the nationalistic social battle between Louis Pasteur, the French guy, Robert Koch, the German, for example. Then the struggles with the English guys and the Scottish guys between Alexander Fleming and Florey and the other ones involved in the discovery of penicillin. That was good. The stuff about Banting and Best, finding insulin, that was nice. He does do a pretty good job of telling you a little bit about the personality of people, which I like, and also how they run into a bunch of setbacks. And it's really a dangerous game to play trying to discover something. Other people can steal the credit for the discovery. You might not get recognition until 30 years later and not make a dime. So all of that was interesting. And it is wise to patent your product if you make one because you might as well get some money from it, and someone else is going to do it and steal the money. So I think if a person was also a newbie, like had never read any medical history before, then they would find it more interesting, all the stuff on cardiac disease, diabetes, and Semmelweis. But I've read all this stuff before, heard all this before, so there was very little new information for me. And what I'm also going to try to tell you, this is like the echo of the Matrix. He's only telling you what the Matrix wants you to know. Conventional medicine always portrays the doctor as this great hero making all these different discoveries. And it's always, this is what the doctor can do for you. It's never, this is what you can do for yourself. And what you can do for yourself is like a million times more important. Don't get me wrong. Sometimes you need the doctor to help you. Sometimes you'll have an infection. I had an infection in my eye. I needed to take the eye drops. My diet was perfect. My sleep was good. Everything was good. But I still needed those infectious antibiotics, eye drops. So sometimes you really do need that medical system. But, there was tons of opportunities. He was talking about hypertension, diabetes, obesity, coronary artery disease, cancer. There's tons of things a person could do to reduce the risk of those conditions, treat those conditions, and prevent those conditions. And also, when you don't know any of this other stuff, like I'm talking about, the non-conventional stuff, then there's a tendency, because you don't really understand it, to exaggerate the so-called benefits of CABG, coronary artery bypass graft, meaning open heart surgery for coronary artery disease, PCI, percutaneous coronary interventions, like placing stents, for example. Also pacemakers, AICDs, automatic implantable cardiac defibrillators, and cardiac transplant, like for congestive heart failure. So he sort of exaggerated all that stuff. And it reminded me, there was some other book on the history of cardiac treatments. And they like using Dick Cheney, the former political guy, because he himself went through all the manifestations of coronary artery disease treatments. Like getting, angioplasty, stent, pacemaker, cardiac transplant. And the reason why I thought it was funny, it was the authors of that book tried to pretend, isn't this great, all these advancements in cardiology. And I was thinking to myself, isn't it funny what a bunch of dumbasses you are, that you could have prevented all this stuff with a low-fat vegan diet, and you wouldn't have had to do all this, hocus pocus, magic surgical stuff. You could just eat a low-fat vegan diet. Okay, but that's not in conventional thinking. Conventional thinking doesn't know anything about low-fat vegan diet. And I'm also going to tell you, you can be first in your class, 99% boards in med school and residency, which I was, and not know anything about nutrition at all, or about dental, or about toxicology, or about blood flow, or about mitochondria. None of the most important stuff is in the books. Okay, let's see what else. So I basically think Andrew Lamb is a good guy. I think he's got potential to get better and better. He's playing it safe, though, too. He wants to thrive in conventional medicine, which means you have to be a good boy. You can't criticize conventional medicine. You can't criticize how stupid a lot of these things they do are. For example, they talk about these early treatments of chemotherapy for cancers where you got more dead patients than living patients. He talked about all these surgeries where, he had some surgery, 11 out of 12 bad outcomes before a good outcome. So there really are problems with the research, okay? And they should be doing more surgery on animals before they're doing stuff on humans, because they were like figuring it out on humans, and there were a lot of patient deaths in the surgical business and the chemo business before they figured it out. There was pretty much nothing I would consider controversial in it. There's nothing whatsoever he could get in trouble for. There was nothing that will piss off conventional medicine. And to me, that's kind of a weak sign. The book I thought was kind of generic. He did a good job of, studying some of the details about the lives of Pasteur versus Koch, Fleming and Florey, and the other researchers involved at that time. So he did do some digging around to try to get those stories straight. And I think he did a good job of that. But again, this is conventional medicine. This is not the deeper truths of nutritional and toxicology and all this other stuff. And what I'm trying to say is anybody could have wrote this book. If it didn't say his name on the cover, it could have been written by, a couple thousand other doctors. Whereas one of my books, I'm the only person in the world who could write them. Everybody who knows me, knows my books, knows that material, knows that no one else could write those books. And I think that makes the book better. Like my doctor friends will tell me, oh, we love all your jokes, your metaphors, your paintings, and all this other stuff. But you could never be allowed in a conventional setting because you make fun of the problems of conventional medicine. You talk about religion. You make jokes. That's all considered completely inappropriate. And I go, well, it's all part of the story. They go, you like it, right? You think it totally fits and it's good. They go, yeah, but you can't do that in conventional medicine. So what I'm trying to say is conventional medicine suppresses telling the truth and being honest about it and objective about it and communicating it like you would to a friend. It doesn't allow you to do that, which means that conventional medicine's atheistic Darwinism mechanism of conveying information and teaching is weak. So overall, if you're a newbie and you want to get an introduction to medical history from a conventional point of view, I think it's a decent book for that. There's no pictures. Well, actually, there is a couple pictures. There's a couple pictures of some of the famous discoverers. Like here's a picture of Banting and Best, with one of the dogs they were working on to isolate insulin, that sort of thing. So, anyways, decent book, but nothing special. I read it while walking on a treadmill in 2 sessions, so in about 4 hours. But, I would go kind of fast through parts of it that I thought were boring and stupid. I just couldn't take it because I've heard all that stuff so many times before. So anyways, hope you found that helpful.